I mean, I had a patient, a pregnant patient, who was on multiple psychiatric medicines. And I was concerned. I was concerned not only because of the diagnosis that she told me, she was a new patient to me. And I'm not a psychiatrist, so this is not my expertise. But the multiple medications that she was under didn't make sense to me. Basically, putting it simply in lay terms, uppers and downers and sideways, basically, everything kind of thrown in. And she told me the history of how she got on them. She came in with this symptom, was given this. And I started to be suspicious of this. And I thought, I don't know if she's seeing a psychiatrist. So I said, well, listen, in pregnancy, there's quite a few of the medications you're on that are not healthy and not safe for pregnancy. And I'm not comfortable saying you should come off them. I'm not a psychiatrist. I would like you to go to your psychiatrist and ask them what medications that you can be on and what you can't be. She came back and said that she was told that they were all perfectly safe in pregnancy. And I said, if you don't mind, I would like to speak to your psychiatrist. I'd like to hear that or at least get a consult about it. So I called, left a message, and I was called back. And when I was called back, the person on the phone said, I'm the psychiatrist looking after XXX. And I said, you're the psychiatrist? And she said, yes. And I had Googled and looked up. And she was not a psychiatrist. She wasn't even a psychiatric NP. She was a nurse practitioner who was now practicing in the realm of psychiatry, supposedly under supervision, but there was no supervising doctor around. Anyway, I said to her, but I'm a bit confused because you're not a psychiatrist. You're a nurse practitioner. And she said, I am a psychiatrist. I said, I've looked at your credentials. I said, I don't think that it's right that you show yourself as being a psychiatrist when you're not. She was fuming with me, actually started yelling at me and hung up. Yes.
Wow, that's an incredible, and you're an OBGYN physician. So, and so this is not only, of course, the woman who we're concerned about her health, but we're concerned about this baby. And so to have someone so cavalier about all these psychiatric medications and misidentifying herself, that is just egregious. So did you end up doing any kind of report, or you just shared with the patient, or how did you handle that?
I tried to report. I tried to get a hold of her supervising physician first. I left messages with the office manager. I emailed. I tried to do everything I could. It went nowhere. Nobody got back to me.
I ran into that recently. There's a nurse practitioner in our community who's doing some things that just don't make sense. So I tried to reach out to the supervising specialist, and crickets. So, just as much as, we have to point the finger at ourselves as physicians, as a medical community, just like when I hear things like doctors are arrogant, or we do need to look at ourselves. And of course, we need to fight against people that are not practicing medicine correctly, because really they can't. They don't have the credentials. But also we need to look at ourselves and our role in this and hold our own selves accountable, because, we're complicit if we're not speaking out against this and we're not acting responsibly. If you'd like to learn more, I encourage you to get the book, Patients at Risk, and the follow-up, Imposter Doctors. And if you're a physician and you'd like to learn more about getting involved, join our group. It's called Physicians for Patient Protection. Our website is physiciansforpatientprotection.org.